Welcome back to another episode on the Precision Health with Mirthe podcast. I am very excited to have you back. Now, in today's episode, I want to talk about stress and how that can have a wide-reaching effect onto our whole body, but then also a more functional medicine approach to it, where we know that our body, how well our body is functioning, if there's inflammation, gut issues, how that can have an effect onto our stress and how well we can deal with therapy, stress management techniques, because we often say that if we have a toxic brain and body, it is really hard to actually be able to do therapy and make changes even though you know you should be doing them. Now, how is that all linked? We'll talk about that today. Now, first of all, just a little regression into biology. You might remember from biology class that we have different types of nervous systems. The one side is the stress, fight or flight nervous system, the sympathetic one, and the other one is the parasympathetic one, the rest, digest, and heal nervous system. And the main nerve there is called vagus nerve. Now, we can only really ever be in one or the other state. That's kind of to kind of make really simplify it. And if we are in the fight or flight mode, our body pumps out adrenaline and it eventually pumps out cortisol, and we need all of that to mobilize away from a perceived threat. Let's say there's a tiger that is running behind us. We need a lot of extra energy to run away from the tiger. That is really important. Also, if we have a short-term deadline, then usually that short-term stress on our body, that fight or flight mode, makes us be more productive, work better, focus, and then perform better. But then the important part is that it has to then taper off, and we need to go back into that rest, digest, and heal mode in order for the body not to constantly pump out cortisol and adrenaline, but go back into the rest, digest, and heal mode. Now, when we're in the rest, digest, and heal mode, our vagus nerve can do its thing. It can send signals from the brain into all of our organs, such as our heart, but also our gut, to help our gut digest, help keep the gut healthy, prevent food intolerances, digestive issues, chronic infections. It helps our heart calm down. It helps our kidneys and lungs. Lots of different really important effects. Now, when we are in an acute stress, that is not a problem. If we stay in that stressed out state for too long, that's when we run into issues. Now, normally, if you look at a daily curve, in a healthy state, first thing in the morning, we want a nice spike of cortisol that gets us out of bed, gets us motivated, gets our immune system woken up, and everything just firing in all cylinders. And then it should be tapering off throughout the day so that we can then at night have a really nice night's sleep, rest, recover, restore. Now, the problem arises if we pump that cortisol up and then it stays elevated when it should be coming down. So there are different stages of stress where initially we have an acute stressor, goes away, no problem. If we are stressed and then that continues to stay, our cortisol stays elevated for too long, too often, and that's when we start having symptoms. And that's when we start feeling things like being wired but tired, going to bed being exhausted but not being able to sleep because we're just wired, we're ruminating, and we just can't calm down. We feel like we're running away from a tiger. We're also having potentially heart palpitations or sweating, or we're having anxiety attacks, feeling really anxious and nervous, but also our blood pressure goes up. And then more on a systemic level, it can be things like digestive issues. It can mess with our hormones. It can slow down our thyroid so that our metabolism starts to slow down. We start to accumulate fat around the waistline. Even if we're overall skinny, we can start to just keep that layer of fat around the belly. We might also start to have problems with our cycles if we're women and still in our fertile years, that we have PMS or we're missing ovulation, having problems with fertility. It can also drop testosterone for both men and women, and that can then lead to lack of libido or problems building muscle mass. Lots of wide-reaching effects, as you can. Now, some other factors that can show that we're stressed out, but we're not in that burnout stage yet, is that we can be really hungry all the time, and we are just starving and craving foods that are not that good for us. So when we're really acutely stressed, oftentimes people say, when I just have a short deadline or some stressful presentation, I will not eat and I'm losing weight. But if that then stays on and I'm just stressed out all the time, then all of a sudden just looking at something, I gain weight, or I just can't deal with my food cravings and I give in all the time. So that is a really common concern that I see with my patients. And there's actually a biology behind it. Now, we have a prefrontal cortex that helps us make rational decisions. It helps us to make decisions where we look into the future and we can say, okay, well, eating this salad will be good for us in the long term, health-wise. Eating this piece of Cheerios will do this for us, so let's not do that. Now, there's also a part in the back of our brain, in our reptilian brain, called the amygdala, and that is it's the survival mode. Now, when we are stressed out, and in particular when we're chronically stressed, then our decision making switches from the prefrontal cortex back into that reptilian part of the brain, into survival mode. And then it becomes really hard to make good decisions on lifestyle and diet choices. For example, if we're being presented with different food choices, we will just eat whatever is there because it's so hard for us to make that decision and not go for the highly palatable foods. Especially, research also shows that we just crave those highly palatable foods, high in sugars, high in carbs, high in fats, because the body thinks that that's what it needs to survive, because it thinks it's under threat and doesn't know when it will next get any kind of energy. Another thing that happens is that when you are chronically stressed out and having high levels of cortisol, we are more prone to wrinkles and also degradation of our joints, bones, and overall tissue and muscle mass as well. Now, reason being is that if we're stressed out, our body, our liver will actually make sugar, and it will pull any of our stored substances, including protein, from our bones, muscles, our collagen in our skin is also made out, that's a type of protein. It will pull all of these protein types and turn it into sugar, something called gluconeogenesis, so that it has energy to run away from this perceived tiger. Now, what that means is that it breaks everything down and that we get brittle, weaker, more wrinkly, older, and have a harder time to make lean muscle mass and just be really healthy and fit and thriving. Now, if that continues for a long time, we then head towards burnout. But that usually lasts many years. We can be in that stage where we're too high in cortisol for a very long time, depending on the person. Now, if that state stays and persists for a long time, then eventually our brain will maybe start telling the adrenal gland, where we make cortisol, that enough is enough, our body needs a break, and then it will stop making cortisol, or only very little. Now, what then happens is that instead of having that nice spike in the morning and then taper off throughout the day, we just flatline. We don't have that spike of cortisol in the morning. And that's when we are basically heading towards burnout and our body is just depleted. And symptoms of that can be that we just, instead of being wired, we're just tired. We can't get out of bed. We can't get enough sleep. We just constantly sleep, basically. And also that we're losing interest in things that normally excite us, things that we usually love doing or that we're usually very passionate about. They just don't excite us anymore. Your favorite meals, your favorite people, your favorite activities, everything's just too much. You might go and become more depressed, withdrawn. You also might just then run into real health issues. So research shows that having that low cortisol in the morning, lacking that cortisol spike that we need, can contribute to cancers, it can contribute to autoimmune disease, it can contribute to cardiovascular disease, hormone issues. So there, as you can see, it's really a problem. So we don't want to get there, because getting out of the burnout state is a lot harder than fixing it in the pre-state, where we're still firing on all cylinders and burning the candles on both ends, compared to when there's just no candle left. Now, we've talked about how stress has wide-reaching effects in the whole body, but there's also the other way around, like I mentioned in the beginning. from a functional medicine perspective, we consider most things as a two-way street, but in particular stress. Now, if we're stressed, it has wide-reaching effects on everything. But if there are problems in the body, it can have effects on the way we deal with stress and whether we are able to manage stress. Now, oftentimes people say, well, you're stressed out, go and see a therapist and talk it through. Maybe you have some unresolved trauma. Maybe you need different coping mechanisms. But that's all well and good, and that is all very important. But some people might just not be biologically balanced enough to be able to make those changes. So if they don't have the right amount of neurotransmitters in the brain, such as dopamine and serotonin, for example, then it can become really difficult for them to implement those cognitive behavioral changes that their therapist is telling them. And they might be trying, but if they're not balanced nutritionally and their body is inflamed, then that's much harder. So in a functional medicine, from a functional medicine perspective, we look at that and we try and balance the whole system so that everything can function optimally. So for example, what I said before is that if we're stressed, it has an effect on our gut health because of the vagus nerve, how that is linked. The vagus nerve is our parasympathetic, our rest, digest, and heal mode nerve. If that's turned off most of the time because we're always in fight or flight mode, then our gut health will deteriorate. Now, if we have a problem with our gut, that will also affect our brain. There's something called the gut-brain axis. A lot of research has been dedicated on that in the last decade or so. Now, if we have a gut issue, it becomes really hard for us to be calm and make good choices and recover from a stress-related problem or burnout. Why is that the case? Now, we all have gut microbiome, certain bacteria and certain types of fungi in the gut, and we need them. They help us break down foods, they help us make nutrients, assimilate foods. They're really good for us. Now, the problem is when we don't have enough of the good types and we have an overgrowth of some bad ones. What then happens is that we have a gut microbiome imbalance, and that then makes our gut lining more permeable. They also call it leaky gut in layman's terms. You might have heard of that. But what it is that our gut lining should normally be really nice and strong. And if there's an imbalance in our gut bacteria, then it becomes more permeable and it allows for particles to pass into the bloodstream that irritate our immune system and make us inflamed. And then that leads to chronic inflammation. And what chronic inflammation does, it messes with the whole body, but it also messes with the brain. And then if we're inflamed, our brain has a harder time to make our calming, nice neurotransmitters, making the right decisions, making serotonin, for example. If we're inflamed, our body takes the serotonin precursors and turns them into a different substance that makes us more irritable rather than the nice calming zen serotonin. Also, if we are inflamed because our gut is unhealthy, then our brain will think we're running away from a tiger because it can't distinguish between a real and a perceived threat. And then what it does, it will shift us into the survival mode and not in the prefrontal cortex, and then it becomes really hard for us to go to therapy and actually take those changes on board and make those decisions. If we're just nutritionally imbalanced, if there is inflammation, if there are gut issues, then it makes it much harder to make changes in our behavior. Now, there are also other parts that play a role. So for example, if someone had trauma in childhood, such as called adverse childhood experiences, ACEs, there's a lot of research done in the last few years on that, then if that hasn't been dealt with, it will make our cortisol reactivity different, meaning that if we're being presented with the same type of stressful event, we jump into that stressed out survival mode much quicker, and it makes it much harder to make the right choices, and we're constantly in the fight or flight mode. So there's this whole, we have to basically work on it from all angles. You can work with a therapist to try and fix that reactivity and change those patterns and the trauma and try and reframe it, and then also balance everything in the biology so that you can actually make those changes. Another important thing from a functional medicine perspective is that we need the right building blocks to be able to make the right nutrients and to make the right neurotransmitters in the brain. Again, serotonin, dopamine, but also GABA, which is the kind of our calming neurotransmitter, helps us sleep, helps us make our hormones, progesterone, again calming, helps against anxiety. Now, if we don't have the right building blocks, then our brain and our body struggles making them. A lot of our neurotransmitters are actually made in the gut, but also some in the brain. But overall, we need the right building blocks. Now, neurotransmitters like serotonin and dopamine are mostly made out of protein, and then we need some minerals and some vitamins to convert the precursor into the active form and then also break it down again. Now, if we don't have a nutritious balanced diet, then we're struggling to just even make them, and then it becomes really hard to calm down, even though you're trying to meditate, trying to practice mindfulness, you're going to therapy, but you just don't have the right building blocks, you don't have the right nutrients to convert it, and then it makes it really hard. If you have a toxic brain or your brain is just depleted, it's so hard to make these changes. So from a functional medicine perspective, we try and balance everything so that you can give yourself the best chance to be the best version of yourself, so that you can stop acting from your survival brain so often and can be more in your prefrontal cortex and just make better decisions so that you can be more yourself. Because oftentimes when we act out of the survival mode, we feel like something's acting with us. We're not really acting ourselves. We're not putting our best foot forward, and then we get mad at ourselves for acting that way, and then it's kind of another vicious cycle. So ideally, we want to attack it from all different angles, support ourselves, nourish ourselves, fix the gut, make sure we have a balanced, nutritious diet, the right proteins, different nice colorful vegetables for all the different minerals and vitamins, so that everything can be really nice and balanced, and then our brain can function. A few last comments as well that I don't want to leave this episode without is there are some other factors that can also mess with our brain chemistry. One are heavy metals. So I see that quite often, that people have a high load of heavy metals such as mercury and lead. So mercury usually comes from either eating tuna on a regular basis or from old amalgam fillings that have mercury in them, or even if the fillings have been removed decades ago but no real detox program has been done after, they can be stored. And when they're stored in the body, they're much like inflammation. They will trigger a little free radical damage to our cells, which will also trigger inflammation, but also directly mess with our brain chemistry. And then it's really hard for the body to make the right neurotransmitters, deal with stressors. And also, if there is a heavy metal load, the body will perceive that as a stress in and of itself and turn into survival mode. Lead often comes from tap water, so it's better to have nice filtered water. And then also other things like plastics, so drinking out of plastic bottles all the time, drinking coffee and tea, takeaway coffee and tea from plastic mugs, having takeaway food in plastic containers. So the best is to minimize these things. I know nowadays it's not possible to completely get rid of it anymore, but just minimizing where and when you can, without obviously having to live outside of society. But if you just avoid hot liquids, hot food and drinks out of plastic, that's already a big step in the right direction. And then if you have a nice filter, and then just have some glass bottles where you store it, or some stainless steel bottles, just to reduce your toxic load and reduce the stress from the outside, so that you can actually deal with any trauma that might have happened to you and makes you very cortisol reactive, or any other work stress, life stress, relationship stress. Just deal so that it makes you more able to deal with all of these things that are being thrown at us, and there are always things being thrown at us. There are a few other things that you can do to support your stress levels. I won't go into a lot of details in this episode, but just one that I want to touch upon today is oxytocin. Now, oxytocin is our cuddle hormone. It also gets released when a woman is breastfeeding, but it also gets released when we are having sex, when we're cuddling, but also when we're having a massage, or when we're, let's say, we're stretching, or we're doing some rolling ourselves on deep tissue work. If we're just working with ourselves in our body, oxytocin can be released as well. Petting a dog. Also, if we're just spending time with our friends and something called social connectedness, when we have a social network, friends, family, play, meaning and purpose, they've all been shown to mitigate our stress response and actually be really beneficial. So it's really important to make time to play, make time to spend time with loved ones, or time to yourself, have that massage, have that hot bath, or some stretching. And then hopefully you can get all of that nicely and balanced and not stress about, pun intended, stress about getting rid of your stress too much. Now, I hope you enjoyed this episode. I would love your comments, and if you found this helpful, if you would like for me to dive into some of the parts a little bit more in detail. And there's obviously lots of parts to the health puzzle, including just this section, stress. There's so many different topics, so many different parts. If you would like for me to dive into some of them more, let me know. I'd love to hear.